Once the patient is stable, usually what you'll see them bridge them over to next is the enoxaparin, low molecular weight heparin. That's the brand name Lovenox. What's advantageous about this over the heparin is the dosing is fixed and it's based on weight. So you don't need to monitor PTT and platelet count when it comes to Lovenox. It's also available as a sub-Q injection, which makes it easy for the patient to self-administer at home. But same adverse effects, hemorrhage, so be aware of your signs and symptoms to educate them to report, and they can experience HIT with the Lovenox as well. So if a patient is receiving an IV infusion of heparin to treat PE, which laboratory value will the nurse monitor to evaluate treatment with this medication? PTT, PT, INR, and then lastly, hemoglobin or hematocrit. For heparin, we're going to monitor PTT, which I'll put into the chat. Sometimes you might see this on the report as a PTT. And what's also not listed here as a choice, remember that we're also going to monitor platelet count. So for heparin, PTT, and platelet count. And remember that if the platelet count falls below 100,000, think of HIT. Heparin needs to be stopped. Choice number 2 and 3 are referring to labs that are monitored for warfarin. For warfarin, we look at PT and INR. On this slide is a nice illustration of all of the oral and non-insulin injectables. So there are injectables that are non-insulin for diabetic patients. You could see the mechanisms of actions are illustrated here. Some of them stimulate the secretion of insulin. Some of them suppress glucagon, which we know raises glucose. Some of them decrease glucose production in the liver. Some of them block reabsorption in the kidney to push it back to push it out into the urine so it doesn't go back into the body. Some of them promote uptake into fat and muscle. Some of them block reabsorption of glucose in the gut, as well as working on appetite control.